I'm Amna Shah, your MLA for Surrey City Centre and Parliamentary Secretary for Mental Health and Addictions. I would like to acknowledge that we are on the lands of the Coast Salish peoples, including the Semiahmoo, the Katzie, the Kwikwetlam, the Kwantlen, the Kakite, and the Tsawwassen First Nations. We are joined today by some very special guests. We have Premier David Eby here. We've also got Terry Young, Minister of State for Community Safety and Integrated Services. We have Dr. Daniel Vigo, BC's Chief Scientific Advisor for Psychiatry, Toxic Drugs and Concurrent Disorders. We also have Jennifer Duff, who is the Chief Operating Officer for BC Mental Health and Substance Use Services. And we have Fatima Benrabah, a registered nurse with Correctional Health Services. I'd also like to acknowledge we have Mayor Brenda Locke here as well. And thank you all for being here at this very exciting announcement. And before we jump into it, I do also want to acknowledge Minister Josie Osborne, who is also in attendance. It's her work and her determination which has been the vital component to getting us here today. So thank you, Minister, for your ongoing commitment and to continuing to strengthen our healthcare system. And also to building out the continuum of mental health and substance use care in this province. And it's important because that way people can get the right care for them when they need it. So now, without further ado, I would like to invite Premier Eby to tell us more about why we're here today. Over to you, Premier Eby.
Thanks, Amna. It's great to see everybody here. The sun is shining in Surrey. Mayor Locke, thanks for welcoming us to the city. We're out front of the Surrey Pretrial Centre here in Surrey. It's a provincial correctional institution, and an incredibly important and core to the announcement that we're making here today. But I'll take a step back. Here in BC, and not just in BC, but across North America, we've seen the impact of synthetic opioids, incredibly powerful drugs that have killed people in unbelievable numbers. And for those that it doesn't kill, when people overdose, they often end up with serious brain injuries. The combination of serious addiction and mental health issues has really created a new cohort of patients, of people who need care in our province. And often they're not able to ask for help for themselves. They're too deep into their addiction, they're too deep into the mental health issue. And so what happens is they continually cycle in and out of prisons, involvement in crime, and then back into prison, and they don't get better. They just continually struggle and often then ultimately die. It's my commitment to British Columbians that we were going to find a way to do better for people who are struggling in this way, for their safety, for their health, to try to get them back on track, find a way to rebuild their lives, but also for the safety of the broader community, the safety of people in our province, because for a small cohort of these individuals, they are involved in crime that compromises the safety and the comfort of people in our province. I asked Dr. Daniel Vigo to come and assist us with this profound challenge that our province faces, to provide advice to us, and he's done some incredible work to bring together leaders in the field, to work closely with corrections, with other partners to find real solutions that are going to make a difference for people who are struggling in our community in this way. I'm just profoundly grateful to you, Dr. Vigo, for your work on this and for getting us here to this announcement today so quickly, as well as I want to express my appreciation to the team at Provincial Corrections, the Surrey Pretrial, the Health Authority, and others who helped pull all of this together for us. Today we're announcing that at the Surrey Pretrial Facility, the 10 beds that we committed to opening for involuntary mental health and addiction care within the Surrey Pretrial Facility are open. These beds are opening for men who are in the pretrial facility, who are struggling with serious mental health and addiction issues that have brought them into contact with the criminal justice system and that are in mental health crisis within the prison itself. By having this facility within the pretrial center, it gives us the opportunity to intervene to ensure that they are stabilized and supported, and for those who can't be stabilized, that they get the additional care that they need. Previous to this, obviously mental health and addiction services are available in our correctional facilities, but they really require the ongoing cooperation and participation of the individual who is in our facility. And one of the challenges I think that judges sometimes have when they look at a person in front of them that's been involved in breaking the law, whether property crime or violent crime, and they see that they're struggling with serious mental health, addiction issues, brain injury, they say, is prison the right place for them? Don't they need health care? Don't they need supports? Well, it is my sincere hope that this facility, along with additional facilities that we are working on across the province, will provide the justice system, will provide individuals struggling in this way and communities with the answer to that question. The health care will be available, the interventions will be available, and that we will be able to ensure safety for people who are sick and need our help, but also provide that safety and that reassurance to the broader community that we are intervening and making a difference. This is not the whole answer. This is just part of a broader piece of work that Dr. Vigo is doing. It started with a direction to physicians and nurses working in hospitals and emergency rooms so that they know clearly what their options are in terms of intervening when someone shows up who needs involuntary care at our hospitals. He's continuing that work in opening facilities here in correctional institutions for those in custody, but also we're opening additional beds soon for people who are not in custody already, so we can also intervene for people who are in community who need this assistance as well. We've got a lot of work ahead, but today is a very good day because it shows that we are making progress on this critical issue. To the best of our knowledge, this is a first in Canada, and I'm sure it will not be the last. Because if I've learned anything from the work that Dr. Vigo has done so far, is that we can make a very serious and substantial difference in community safety, in the safety for individuals struggling in this way, and my suspicion is that we're going to see very positive results coming out of these interventions that we're going to make in the lives of these people who are in custody in our prisons right now in British Columbia. With that, I'll pass it back to Amna, and with appreciation for her emceeing here today. Amna?
Thank you very much, Premier. So this designated mental health unit will help people with incredibly complex mental health and substance use challenges who are incarcerated and are in crisis. So through this service, they'll be able to access specialized care to meet their unique needs when they may not be able to seek it themselves. So this is vital to helping people on the pathway to recovery while also keeping our communities safe. Now I'd like to invite Minister Terry Young to come and speak.
Oh, I think this is something right higher for me. But anyway, thank you very much for being here today. Today's important day announcement, a step in improving care for people with overlapping mental health and drug addiction, substance abuse challenges. I want to thank the Premier, I want to thank Parliamentary Secretary Dr. Vigo and the team of experts across ministries and government, part of our commitment to make sure we all live in safe communities because we can address these complex issues facing public disorder or sometimes community concerns. As the Premier said, toxic drug crisis changed the way we're seeing a small but growing number of people with extreme complex needs. And they're suffering from severe mental health, substance abuse that are not treated, compounded with brain injuries from violence or overdoses repeatedly. And it's important that they don't get stuck in a cycle that's associated with the criminal justice system, because that's not going to make us safer. But providing the much needed concurrent help, mental health and addiction recovery treatment is more humane way and more productive way to police ourselves out of here. As a former police officer for years, I actually worked in downtown East Side. I knew people by first names, the family members, they belong to a community sometimes they're isolated from. And we want to reestablish that needs for a facility like this and the good work that the team is doing here. At the end of the day, this is consistent with your government's commitment to make sure our communities are safer by addressing the complex needs of people out there on the streets And we cannot just simply police our way out of it. We need to work across ministries and government and the experts panel behind us work very hard for the last few months to make this a reality. So thank you very much for your time, and I'm going to pass it back to LMC.
Folders are piling up at the front. Thank you so much, Minister Young. Next, I'd like to welcome Dr. Daniel Vigo, BC's Chief Scientific Advisor for Psychiatry, Toxic Drugs, and Concurrent Disorders, to say a few words. Please.
Thank you very much. I want to thank the Premier, the Ministers and their staff for the work in support of my recommendations to improve the care for people with severe mental illness, substance use disorders and acquired brain injury. I also want to thank PHSA and Corrections for their efforts to have this mental health unit ready in record time to serve the first 10 patients at the highest level of need. Indeed, patients with this new clinical triad frequently find themselves in conflict with the law and end up on remand in Surrey or North Fraser pretrial centres. Up to now, patients requiring involuntary care due to psychomotor agitation, psychosis, mania, or other severe mental syndromes resulting in impairment had to wait in segregation for weeks or more for a bed to free up at the forensic hospital, unable to receive care. Through these concerted efforts, our patients will now receive the level of psychiatric care they need the moment they need it. This will result in the prevention of harms resulting from weeks of untreated agitation and psychosis. It will result in the implementation of a care plan sustained throughout their time in corrections and integrated with services in the community when correctional supervision ends, improving not only their mental health and substance use outcomes, but the safety of the community. This unit is another step in the comprehensive improvement of mental health and substance use services in the province, which includes streamlining access to life-saving pharmacotherapies, the scale-up of assertive community treatment teams, starting with a focus on areas with the highest level of need, the creation of approved homes, such as the Alouette Homes, opening in Maple Ridge next month, the creation of decentralized psychiatric rehabilitation beds, for which planning is advancing at full speed, the integration of services for mental health and substance use, and the clarification of the proper use of the Mental Health Act for people with substance use disorders. These changes will require substantial societal efforts in the coming years, some of which we knew of and some of which result from unpredictable global events that have placed unforeseen financial constraints on a country and a province. But these efforts are required without hesitation if we are finally going to curb the public health emergency declared in 2017 by improving care across the continuum of voluntary and involuntary services, decreasing overdoses, preventing acquired brain injury and death, and transforming the lives of our patients, their families, and our communities. Thank you very much.
Thank you, Dr. Vigo. And working to support some of our most vulnerable populations is very difficult, but it's necessary work. And so I thank you, Dr. Vigo, for your dedication to this and helping people with severe and overlapping challenges access the care that they deserve. Now I'd like to invite up Jennifer Duff, Chief Operating Officer of BC Mental Health and Substance Use Services, to the podium, please.
Thank you very much, Parliamentary Secretary Shah. And thank you, Premier David Eby and Terry Young, and of course our Health Minister. And a special thank you to Dr. Vigo for your expertise and partnership with government to make today's announcement a reality. I'd like to highlight the staff, the clinicians, and the leadership working in the building behind me, and all of the staff at BC Mental Health and Substance Use Services, and our partners at BC Corrections, who have worked so hard over the last number of months to make this a reality. In addition to being the Chief Operating Officer for BC Mental Health and Substance Use Services, I've been a registered nurse for 24 years, and I get the privilege to lead healthcare teams across all 10 provincial correctional centres. I want to build on what Dr. Vigo shared and take you through a journey of a client and why this unit is good for patients, good for communities, and good for public safety. Incarcerated people face higher risks and have significantly more complex health needs than many of us. Let's imagine there is a client, and his name is John. Let's say John is 23 years old and he's been previously incarcerated, and he has a history of mental illness, and he uses many different kinds of drugs. Yesterday, John was arrested, and seemingly okay as John was brought to the facility here awaiting trial. A few hours after John arrived, however, his mental status declines and he becomes aggressive and is at risk for harming himself and others and is actively withdrawing from drug use. He declines treatment. Our expert team is now able to provide care rapidly under the Mental Health Act in this case. We have a team of psychiatrists, primary care physicians trained in addictions medicine, a team of 3 registered nurses or registered psychiatric nurses working 24/7, social work, concurrent disorders counselors, and importantly, an Indigenous patient navigator. When it's time for John to return to the community following his incarceration, and he is mentally stable and he has received treatment for his substance use disorder, our community transition team will support a warm handover to community mental health teams, housing, and other supports. The government's investment in this new designated mental health unit is an exciting step in the right direction. I acknowledge we still have work to do, and I am so excited about government's commitment to building a continuum of care for people struggling with mental illness and addiction. Thank you.
Thank you so much, Jennifer. I appreciate all the work that you do. Now, last but not least, I would like to invite Fatima Benrabah to share her story. Fatima is a registered nurse with Correctional Health Services and works day in and day out to provide vital care to some of our most vulnerable populations. So I'd like to welcome Fatima to the podium now. Thank you.
Thank you. Good afternoon, everybody. My name is Fatima Benrabah, and I'm a registered nurse. I have been working with Correctional Health Services for about 11 years. I have taken care of acute and complex patients during their incarceration. On behalf of the healthcare team, we are excited to unveil the new mental health unit. This is a pivotal moment for us as it represents not only a significant step forward in the care we provide, but a progressive approach to mental health within our communities. Once a patient is placed under the Mental Health Act, they will be admitted to the mental health unit where we will initiate assessments, interventions, medications without delay in patient care. Our team will consist of physicians, psychiatrists, psychologists, registered nurses such as myself, registered psychiatric nurses, and pharmacists, and we will collaborate with the patient to deliver patient-centered care. This unit is the first of its kind, where patients receive care and treatment without stigma in the context of incarceration. This support and care will be available to our patients 24 hours a day, 7 days a week. We are incredibly proud of this initiative and the positive outcomes it will have on those we serve. This is exciting for all of us, especially for our patients and their families. Thank you. Thank you.
Thank you so much, Fatima, for your positive outlook, and we look forward to you continuing the great work that you already do with our vulnerable populations. Now, this brings us to the end of this afternoon's event. I want to thank again Premier Eby, Minister Young, and Minister Osborne, Dr. Vigo, Jennifer, and Fatima for being here today. And I'd also like to reiterate what was said in thanking the many healthcare workers who provide essential mental health and substance use care to people all around BC. You know, your work is so vital and you make an immense difference in people's lives. So to all of these healthcare workers, I say thank you. And now we will take questions from the media.
Thank you so much. We're going to take some questions from media. We're going to start with media on site and then go to the phone for reporters on the line. Please remember to press *1 on your device to be placed into the queue. We'll be doing one question and one follow-up, and we're going to start with Aaron MacArthur from Global News.
Thanks. Premier, I think when people hear the term involuntary care, they're expecting people to be taken off the street and not provide any more harm to the public. This is not that. I know you mentioned beds are coming that more accurately reflect that assumption. Can you give us a timeline on when we might see beds out in the public and not in correctional facilities?
Yeah, sure. Thanks for the question. We'll be opening additional beds later this spring that don't require that someone's already been arrested. But I think it would be a mistake to see these beds as being somehow disconnected from what's happening in community. These beds create the possibility that when someone's arrested, they're brought into the remand center, and then they're identified as struggling with serious mental health issue, addiction issue, brain injury, all three at the same time. That even though their time in the criminal justice system may wrap up, that they would still remain in treatment and they would be streamed into treatment programs and beds that already exist. For example, the forensic beds that exist at Riverview or other sites in the province. So what this does is it creates the possibility for us to intervene in that cycle of community, criminal offense, jail, community, criminal offense, jail, over and over again. The intervention is potentially to stabilize and get them into support in the community, or if they can't be stabilized here, to get them into those more intensive care situations that they need somewhere else. This is the population that people are anxious about. It's people that are struggling in a way that also compromises not just their safety, but also the safety of the broader community as a whole. And so that's why we're starting here, but we're not stopping here.
As a follow-up, I don't know if this is maybe for Dr. Vigo, but how many people, is there an estimate of how many people would qualify for involuntary care and how many people need that sort of treatment, that level of treatment?
So right now across the province, we're modernizing or opening 400 mental health beds at hospitals across the province. 140 of those beds are brand new. The remainder are being updated and modernized. These are at entirely new facilities like in Vernon or additional beds at existing hospitals. And so that's one component of this work. The other component of this work is these 10 beds here. We're opening an additional 20 beds approximately in Maple Ridge at the Alouette facility there. Dr. Vigo and his team are identifying other sites in other regions across the province so that we can distribute this care across British Columbia. People can receive the care that they need closer to home, and that we're targeting different populations that need this care. Dr. Vigo's work has already identified that there are more than 2,500 people in the province that meet the definition of struggling with mental health, struggling with addiction, struggling with brain injury, those three things. But the cohort of people, at least that I think about, the person lying in the street, unable to care for themselves, being exploited by others, the person who's walking down the street yelling at passersby, the individual who's involved in a violent stranger attack against somebody else. That is a much smaller group, and that's the group we're starting with in terms of the target of these particular beds.
Next, we'll go to Penny Daflos from CTV.
Hi, Premier. I just wanted to start out with a question for a colleague, so I'm just going to read it verbatim to you. A man accused of assaulting a police officer in Surrey and violently attacking a woman in Cole Harbour in a 2-day span is now undergoing a mental health assessment. Is it concerning to you that this assessment wasn't done after the first arrest and it took a second person being seriously injured before something was done?
Yeah, I don't know all of the details of this particular case. Obviously deeply disturbing, I understand. It involved a woman who was visiting Vancouver from Toronto and completely unknown to the perpetrator. Obviously, there are serious concerns about the mental health of the individual who perpetrated this attack on this woman. And I'm very hopeful that this individual, that there'll be interventions to ensure that this individual does not repeat a cycle of violence. That's exactly what today's announcement is about. For individuals who are arrested that are involved in this kind of activity, that there's the opportunity for them to be screened in the system and receive the care that they need in the system, so that we don't put courts in the uncomfortable position of having to judge oh, should I put this person back into the community for a mental health screening, but I'm not sure if they're safe. Should I keep them in custody, but are they going to get the care they need in the prison system? This answers the question. The care is available. Crown Defense Counsel will be able to ensure that individuals arrested are assessed, can get the care they need, that they don't have to be released back to the community to potentially commit additional offenses. And so that is the goal that we're aiming at here with today's announcement.
And a follow-up, I think maybe it's better suited to Dr. Vigo. I just want to know if anybody has been assigned to these 10 beds already, and if, given that there's such a scant resource, will you personally be identifying who's going to be part of this first wave and authorizing people to go into these first 10 beds, or will that be up to local clinicians?
Thanks for that question. The team that is leading this unit is composed of the clinicians and managers with the highest level of expertise in the province and probably in the country. And the identification of patients who have this need happens on an ongoing basis in a correctional facility. What now changes is that instead of waiting for a month in seclusion to get treated, they will be able to provide the treatment immediately. So my role is a provincial role advising on the general direction of services for mental health, substance use, acquired brain injury, and then to find, as we did, the best partners to implement that in the different places where we're doing this. Here with Dr. Sitapati and his team, and Dr. Krishnamurti and his team, and in every location where we open units, we have local partners with the expertise to make this happen. Thank you.
Next, we'll go to Anna Burns from Surrey Now Leader.
Hi, Premier. So you mentioned that in the spring there's going to be beds opening to the public, like not the ones that are held. So what does this mean for the average person that uses drugs, and how is this information translated to them? Because what we're hearing is that they're terrified. We're hearing this from community groups here in Surrey, that they feel like they're going to be held involuntarily for using drugs, randomly picked up and locked up.
Yeah, I understand why different groups might feel anxious about involuntary care. We have a really unfortunate history in the province of involuntarily detaining different groups, forced treatment, sterilization, residential schools, you name it. The legacy of institutional care in this province is not a positive one. So I understand why people feel anxious. There is a critical component to the work that Dr. Vigo is doing, which is to recognize the humanity and the dignity of each person that will receive treatment. Leaving individuals to die in a ditch, exploited by others with a serious brain injury and mental health issue to the point where they can't care for themselves is not respectful of their rights, of their humanity. So we're going to intervene. For the vast majority of people that are struggling with addiction, this has absolutely nothing to do with you. We're opening specific voluntary beds across the province. We've doubled the number of people to 5,000 people last year who received voluntary treatment through provincially funded addiction beds in this province, and we're going to continue to expand those voluntary resources. It's for a very small cohort of people who are struggling in a very visible, serious, and public way, where their own safety is compromised, as well as the safety of the broader community. These are very targeted beds, and there are very stringent safeguards in terms of how they're used. For example, for this population here, these are people who are already in custody. Their liberty has already been taken away. They're in jail, and we're providing additional care so that on release, they're either going to a facility where they can get the care that they need, or they're stabilized and connected with care in the community so that they're interrupting that cycle of offending. It's a challenging, nuanced message for people who are like, well, I'm worried the government's going to come pick me up. But I think that what will become quickly apparent through this program is that, first of all, it's net beneficial for the individuals involved as well as the broader community. And secondly, this is a very specific and targeted cohort that is the population we're seeking to serve here.
Thank you. And next question, this one might be better for Dr. Vigo. How do you manage the benzodiazepine withdrawals, which require complex medical supervision and support for people detailed under this policy? And do you have experienced staff to do this amidst the healthcare shortage that's currently going on in BC?
Thank you for that question. For sure, one of the most serious problems that we have is that in BC, now every drug that is bought on the street has every drug conceivable, including, as a rule, synthetic opioids, crystal meth, and benzodiazepines. And so the management of that withdrawal is enormously complex. Now, we will be able to do that, of course. That's what we do as psychiatrists. Managing, weaning someone off benzodiazepines is part and parcel of what we've been doing in the community or wherever for the past few decades, since we learned that we shouldn't use those drugs at all in a chronic manner for issues for which they were used in the past. So now we're doing that with patients who unknowingly became addicted to those by using the illegal drug supply. So the answer is that is exactly the kind of thing that we will be able to do now and that we were not able to do before. Imagine a patient going off this combination of drugs on their own in segregation.
Next, we will go to the phone lines. Just a reminder to media on the phone lines to please unmute yourself when you're called upon. First, we'll go to Rob Shaw from Check News.
Oh, hey, Premier. Wondering what you think of the federal Conservative proposal to change the criminal code to let judges sentence people to involuntary addictions care, and how that would fit into what you're talking about here.
My understanding is that currently judges can include requirements around attending at an addiction treatment facility or program as part of a sentencing for an individual. To the best of my knowledge, it does require some level of participation or agreement by the individual. This proposal going forward is consistent, as I understand it, with some of where Alberta is going provincially. We'll watch carefully to see what Alberta does, and if there are lessons that we can draw from what they're doing there, we will. But for us here in the province, we're focusing on a very specific cohort of individuals that we think will benefit, that the research that Dr. Vigo has brought forward has indicated will benefit directly from these interventions, that they will stabilize, that we'll be able to get them into a better health situation and minimize their risk to themselves and to others in the community. And if we can learn things from other provinces that are bringing in a different approach, then we'll have a look at that.
Rob, do you have a follow-up?
Sure. Just changing topics. 19 chambers of commerce on the island, plus Tourism Association of BC, wrote you a letter today asking you to override the BC Ferries Commissioner and let BC Ferries build a fifth ship, citing the Queen of Coquitlam stranding folks and the age of the fleet. Are you willing to override the Ferry Commissioner or help BC Ferries pay for the fifth ship, or what are you going to do there?
Yeah, there. I think after the weekend we came through, and many people were trying to get over to the island or back and forth, and we're frustrated in that because of the breakdowns in the fleet. We obviously need new boats, and BC Ferries has put forward their best proposal to the Commissioner. My understanding is that they'll continue to have a dialogue with the Commissioner, but both BC Ferries and the Commissioner are independent of government. They're structured that way. They have been for a long time. There are significant implications that come from government intervening and removing that independence, including assuming responsibility for the entirety of the BC Ferries financial set of responsibilities. So it would be a very significant thing. I would just encourage BC Ferries and the Commissioner to remain in touch with each other. I am very sympathetic to the request for 5 ships. I think we need boats that are going to be able to serve the public well into the future here in British Columbia. It's critical for commerce, for tourism, and as the island highway for so many families and businesses.
Next, we will go to Katie DeRosa from CBC News.
Hi, I was wondering if Mayor Locke could weigh in on these beds in the community, if it's enough, and what the mayor has to say.
Thanks, Katie. Yeah, let's get the mayor up here.
The magic. The City of Surrey absolutely welcomes this. It is one of those challenges that I think many cities are facing, but we know in the City of Surrey we've seen people on our street that are over 65% increase over the last number of years. So I'm actually very pleased to hear this work that Dr. Vigo has done and that the province is delivering to our city. So we're quite grateful for that. And I'm very glad to see that the first program is starting here in Surrey. Thank you.
Katie, do you have a follow-up?
Yeah, and Premier, I know you said that the details are still coming through as to the man who attacked the Toronto woman on the seawall, but I guess was your point that individual, if they had been arrested for that incident, they may not have been released on bail because they could have been put into these 10 involuntary beds? And if so, is there an option to expand the 10 at Surrey Pretrial? Will 10 be enough at that location?
Yeah, thanks, Katie. 10 beds is just the start. We know we need significantly more beds. We need beds in correctional institutions. We need beds in communities and regions across the province. You will see more from us on this. In terms of how I hope these beds are used, one of the issues that we've had, there are two challenges. One is the federal law, the federal criminal law, the bail law, that we've joined with other provinces in pushing for reforms to, as recently as last month, asking the federal government to ensure that bail laws reflect the understanding of the community that repeat violent offenders must not be released back to community. That's one challenge. We're working on that with our federal partners. I know it's been a topic in the election. But the second one is when a judge sees someone in front of them who's mentally ill, who's addicted, who's struggling with a brain injury, I think it's reasonable for that judge to say, what is going to be the best possible outcome here? Is it going to be putting this person into jail where maybe there's no services or not sufficient services to respond to the complexity? Or is it sending this person back to the community and hopefully they're going to get attached to some kind of care in the community through the hospital or something else? I want judges not to have to ask that question. I want a judge who's concerned about the conduct of the individual posing a threat to the community to say, I have no hesitation to hold this person in custody because I know there are high quality mental health and addiction and supports and care in the pretrial center, and that person will get the care that they need. So if they have any question about public safety, they will know that if they remand someone into custody, like to Surrey Pretrial, that person is going to get high quality care. That's the goal that I have here, is so that is just not a question that a judge has to ask. Is this person better to get care in the community or somewhere else, if they have any anxiety about the public safety implications of that. So we're doing our part at the provincial level to try to ensure that the court system has those answers that they're looking for each individual offender that shows up. And then we're asking the federal government to do their part, to make sure that the judge has the tools in terms of the actual law so that the Crown and Defence can tailor the best possible solution for the community.
Next, we will go to Vaughn Palmer from the Vancouver Sun.
Good afternoon, Premier. The Alberta legislation introduced last week is broader than what we have here in BC. It doesn't simply apply to people in custody. It allows detention and treatment of up to 3 months. And it also includes and covers young addicts and overdose victims. Are you sure we don't need that kind of legislation in BC?
Yeah, that's an important question, Vaughn. I'm not sure of that. That's why we have Dr. Vigo to advise government on the tools that we should have, and beyond the tools around the law and the policy, also the sites and the care and the services that we need to respond to this. It's the two pieces together, which is why you saw the first care guideline coming out from Dr. Vigo, about involuntary care in relation to people struggling with addiction and mental health issues, potentially brain injury as well, that show up in an emergency room. He is working on the youth side as well, and doing work in relation to that as well. This is an evolving process. We're going to watch what Alberta does. I know they're watching what we're doing. We have different laws in our two different provinces our law currently is under legal challenge right now for the involuntary care aspects. So we're defending that law aggressively because we think it works. We think it saves lives. But maybe I'll invite Dr. Vigo up to share his thoughts on this as well.
As the Premier said, our legal frameworks are different. I think that the way we have approached this issue is we first need to correct some misguided assumptions and some inconsistent practices in BC within the law that we have, which provides very clear criteria for when we can act to help folks who are suffering from mental impairment due to a mental disorder, which includes substance use disorders as a subtype of mental disorders. So what I would say is the law that is being proposed in Alberta is not broader. It is in some sense narrower because it only focuses on substance use disorders, whereas our law allows us to treat people at a very high threshold, which is important when you are curtailing people's freedom, but we can do it across diagnosis. So there are differences. I think the severity of the public health crisis that we have here, and which is really a Canadian and North American tragedy, justifies approaches that seek to remove barriers from care for people who are unable to seek it out themselves. That is what we are doing. We're doing it in a broad but very careful manner with the tools that we have. And as the Premier indicated, we will be closely evaluating both our results as the Alberta results, and we will all learn, because at the end of the day, the ultimate goal is to decrease the negative outcomes in terms of overdoses, death, and acquired brain injury, and improve our community safety outcomes.
Vaughn, do you have a follow-up?
Yes, please, and thank you for those answers. The whole debate in BC, as I recall it, really began with a piece of legislation John Horgan proposed 5 years ago, which would have allowed short-term brief detention of youthful overdose victims. And I noticed the Alberta legislation does specifically apply to young people. Does BC need that kind of protection here, or is that already available, please?
So it's possible. We may need to introduce additional legislation, but the first step is to work within the law that we have. Dr. Vigo is currently doing that work, pairing up the first directive that he did in relation to adult patients with specific advice for physicians and nurses in relation to people who are children or teenagers. What tools are available to them? What assessments do they need to do to determine whether to commit someone to involuntary care? I think it would be best to pass it over to Dr. Vigo on that specific issue.
Thanks for that question too. As the Premier said, we are now going to follow up the clarifications on how to use the Mental Health Act for adults with substance use disorders with the clarifications for how to use the Mental Health Act for children and youth with substance use disorders. You point out to a very concerning situation, which is what happens when a child or young person has an overdose, has repeated overdoses, and you have parents or guardians or significant others asking for help. And just like happened with adults, you have inconsistent responses as to what you can and cannot do under the Mental Health Act. The Mental Health Act in BC, in conjunction with the Infant Act, allows for intervention in many of these situations after careful consideration of various parameters that guide the clinician's decision-making in front of that child. And we are going to provide this clinical guidelines and these general guidelines on the use of the Mental Health Act. There's a lot of people working on that and have been working on that for a long time. And we want to learn from the things that worked and didn't work in the past. We want to know and hear about the concerns that people have when we are, again, engaging people's freedoms, children, youth, or adults. But it is my understanding, and it will be in the general guidelines, that the BC Mental Health Act can be used to protect those kids in the situations such as you described.
Next, we'll go to Ashley Joannou from Canadian Press.
I'm just hoping to give the Premier a chance to respond to the fact that the facility itself isn't ready yet. If I understand, these men, at least for a short term, are still going to be held in a segregation unit while some work continues on the actual facility. Is it appropriate? Staying in segregation doesn't sound that different than how things were running previously. Is it appropriate to be celebrating that these are open when, in fact, we're still going to have to stay in segregation for some time?
Thanks. I'm going to pass that question over to Jen.
Yes, we definitely have to bring this down. I'll give it a moment. It has to come a long way. Thank you, Premier Eby. In fact, the formal unit, the 10-bedded unit, it's open today in segregation, as Premier Eby identified. We are making quite extensive renovations to a former living unit that exists in this facility, and we're making those renovations for important reasons. One, for the humanity and treatment of the people who we will be caring for, and two, for the safety of our clinical teams and staff who work in the facility. How is it different? Well, prior to today's announcement and prior to the funding and the ability to open up this unit, we did not have teams in place working 24/7 in correctional centers, and today we do. And that means that we can care for people from a clinical perspective, a humane perspective, from a healthcare perspective, 24/7 with a team of registered nurses, registered psychiatric nurses, counselors, addictions medicine, psychologists. In fact, in this facility behind me, we have a psychologist who has worked here for over 20 years. And so now that we can provide 24/7 care, it is in fact humane treatment. And in fact, our team, per Dr. Vigo's comments, is specially trained. Perhaps some of the best clinicians in the province work in correctional centers. So I'm confident that our care will be of high quality and very supportive and humane.
Thank you. Ashley, do you have a follow-up? Oh, sorry.
Yeah, I haven't heard an answer yet for how many of the 10 beds are currently full.
So, thank you for that question. I wanted to add to the answer that Jen just provided. It is incredibly better to have someone, once they're put in segregation for their episode of agitation, of psychosis, etc., to treat that person so that they can come out of segregation with a stable, sustainable treatment plan. So this intervention decreases the use of segregation. It is very important for folks to understand this. And so, you know, that advantage is unquestionable. And as to the number, I'm not sure if there's any question about that. It's a 10-bedded unit that will be able to take care of up to 10 people while in segregation. But those folks then will either go back earlier, by the way, to their regular unit or to the community or to wherever, without having to stay there for a month waiting for a bed in corrections, and then, a bed in the forensic hospital, where then the colleagues there have to deal not only with the episode of psychomotor agitation, but with the accumulated harms that result from untreated segregation. So, you know, it's really important for us to understand this piece, This decreases the use of segregation, and this allows for people to seamlessly transition to less restrictive environments.
And apologies for not answering your question directly. The unit is just opened. It's fully staffed. We are presently, as of the time that this conference started, actively assessing one client for potential admission to the particular unit, and I understand that there's 4 other additional clients who are not in this facility that we are assessing for potential transfer to this facility. So given that it's just opened, we're working out the logistics. Also, I think it's important to note that the staff that are working within segregation, this new team that we've hired and is fully staffed, is actively looking at all patients in segregation, not just these 10 beds. So that's what we do as healthcare professionals, just making sure people are safe. We've got eyes on them. There are other clients who are not in this particular unit who require frequent monitoring, and so we're doing that as we speak. So I am very confident that we have increased the level of care in such a positive way for the people who are incarcerated in this facility and desperately need excellent medical care.
Thank you. And that concludes our event for today. Thanks so much, everyone.